Hi, my name is Megan, and I will be doing a PowerPoint on ovarian cysts. So I will cover in the table of contents I have listed, I'll cover the etiology, demographics, anatomy with diagrams, physiology and symptoms with diagrams, as well as the diagnosis and treatment, and AI. The etiology, as far as this goes, basically the cause, like ovarian cysts, are growths that form inside of the ovaries. They're extremely common in almost all females. The most common ovarian cyst is a functional cyst. The primary cause of an ovarian cyst is ovulation. Some other main causes include abnormal cell reproduction, endometriosis, and pelvic inflammatory disease, also known as PID. So there's a variety of ovarian cysts that some women get. The functional cyst is filled with fluid during menstrual cycle. The dermoid cyst is a sac-like growth on ovaries containing hair, fat, and tissue. Endometria are tissues that grow on the inside of uterus and attach to ovaries. The cystosoma are growths that can develop on outer surface of the ovaries, like lining the ovaries. And then PCOS is a disorder due to the presence of multiple cysts on ovaries that cover it. As far as the demographics go, basically females who have ovaries can get ovarian cysts. You're more likely to experience ovarian cysts before menopause versus after, so anywhere after like your early 50s is typically when menopause begins. Women who have a family history of getting ovarian cysts are more likely to get them again. Pregnancy can be associated and linked with ovarian cysts being present. Between the ages of 20 to 50, ovarian cysts are typically developing. Medical conditions such as endometriosis, PCOS, and hormonal disorders, like I said before, can lead to ovarian cysts. The prevalence and incidence rates are similar in the US compared to other countries and can vary just depending on the population, how many people there are, and like lifestyle factors of like diet, and it's kind of hard to detect or basically decide what, if other countries get it more than the US. It's somewhat similar. And this graph here shows that basically the age group of 20 to 30 seems to be when the highest amount of people were getting ovarian cysts, followed with ages 31 to 40. So the anatomy of ovarian cysts, it primarily affects the reproductive system and the ovaries specifically. Ovaries are known as small almond-shaped organs. They are fluid-filled sacs, contain thousands of follicles, each with an immature egg, and ovarian cysts form on the outer surface within ovaries. Typically, if you do get a different type of cyst, they can be inside. There can be multiple cysts as well. This is another side of discussing the anatomy. Ovarian cysts affect various tissues within the ovary. Tissues that are affected include the ovarian tissue, the endometrial tissue, the epithelial tissue. It just depends on the type of cysts that are typically in the ovarian tissue. And a picture I have here is ovarian tissue, and then it shows like the different follicles, whether they're the primary or the primordial. Okay, so for physiology, ovarian cysts disrupt cyclic process of follicle development, hormone production, and ovulation. The follicular, there's three different cysts. The follicular cyst is the follicle that doesn't rupture, releases an egg during ovulation. The corpus luteum cyst releases an egg, doesn't shrink after ovulation, and forms abnormal hormone levels. Lastly, the endometria, as mentioned before, is an abnormal growth of endometrial tissue in ovaries, interferes with the structure and function. And here I have a picture comparing the two, the follicular cyst and the corpus luteum. Symptoms. So symptoms can be asymptomatic, where you won't show any symptoms at all of having a cyst. On the other hand, you can get pelvic pain and pressure, bloating, abdominal swelling, changes in menstrual patterns, pain during intercourse, and severe symptoms include fever, vomiting, and fatigue. So if an ovarian cyst goes untreated, basically it can lead to rupture, hemorrhage, and ovarian torsion. It'll be pretty discomforting, and it affects the daily life if it is a really painful cyst. If not properly managed, the condition can worsen over time and may mean other underlying conditions are present, whether it's cancer or something else that's affecting the cyst. Survival of the ovarian cyst. So almost all ovarian cysts are benign and resolve on their own over time. 70 to 80% of follicular cysts resolve. Mortality rates are extremely low and non-life-threatening. However, mortality rates can occur and will increase if the ovarian cysts are associated with ovarian cancer. Diagnosis. So basically, your medical history and a pelvic examination are important. Imaging tests and ultrasounds as well. And something called a laparoscopy is a procedure with a camera inserted to see the abdomen and reproductive organs. They will make an incision on the abdomen, and basically they'll insert that camera to further look at the cyst. And then basic routine checkups as well. Those help diagnose them, whether you're going to get your physical exam or whatever it might be, seeing a doctor. Treatment. So medications including hormonal contraceptives or non-steroid anti-inflammatory drugs can help relieve the pain when you have cysts. Surgical intervention may be necessary in severe cases if the cyst continues to increase in size, which is causing constant pain or ongoing pain. Risks with surgery include damage to tissue, bleeding, and infection. That is rare typically, but when you get any type of surgery, infections are a possibility of happening, and so it's just something to consider when you are getting a surgery involving cysts. And then monitoring the cyst and going to annual checkups, as I mentioned before in the previous slide. So artificial intelligence, basically AI is being used to assist in the diagnosis and management of ovarian cysts. AI models can help analyze medical imaging data. AI assists healthcare providers in looking at the clinical data and creating treatment plans moving forward. And these models ultimately help for a variety of outcomes related to ovarian cysts, including complications, reoccurrence, and then the response to treatment.